Dr. Amanda with StraightSmile Solutions, and today we're going to be talking a little bit more about DM, dental monitoring system. It's all over the world right now, and it's really come a long way. They are becoming much more friendly towards general dentists, so this is why I've chose to review this system again, and really want to explain to you how I think it can contribute to the ROI of your practice and really help you be more successful in not only your aligner cases, your functional appliance cases, your airway and SDB cases, your braces cases, your anything like that. I think it'll really work well for you. So let's go ahead and dive into some of the features. And thank you so much, DM, for letting me use this presentation. They did give me permission that I could use it. Basically, you know, in a nutshell, this is pretty much the part that I like to see, which is patients monitored with DM are more compliant and experience 1/3 of the problems with aligner seating as compared to other patients. And basically what you're going to be doing is you're going to have a dashboard. Your patients are going to be able to record pictures of their teeth at home. You're going to be connecting with your patient. You're going to be sending your patient alerts. You can pre-program it. And there's all sorts of functionality, and some of it you may use and some of it you may not use. But they're basically going to turn their smartphone into a scanning device, and it is going to capture all sorts of information, not only data of how the teeth are moving, but also compliance and tracking, and send alerts to your dashboard, which will then come to your front desk or to yourself, and you can contact the patient. Nothing patients hate more, really, than coming into your office for an orthodontic visit, functional appliance visit, an aligner visit, and being told, okay, look great, you know, here, wear those a little bit more. Here's a few more. You're thinking like, dude, you totally wasted my time. You know, why do I have to come in here? I could have just done this from home, which is basically the basis for everything, right? Or even a braces patient. They come in and they retie, and they're thinking like, what did you do? Why did I even come in? So if you can collect that information at home and just let the patient know you're doing great. Let's see you in a few more weeks. We don't need to see you right now. You're doing fantastic. Why don't you switch to this next aligner? Patient will really appreciate this. You'll be respecting their time. You're not only, there's a value on your chair time, there's a value on your doctor time, there's a value on the time of all your staff members filling up seats that really aren't necessary to see that patient. There's a value on that, you know, and patient's going to be really appreciative. So basically, in a nutshell, I think that not only from the chair time value, but also from a liability and compliance issue, you really do need to know if your patient is being compliant, and you need to be documenting this. And there's really no better way from a liability and compliance standpoint to be documenting this than DM, having all the information, knowing if your patient's checking in at the intervals they're supposed to be checking in, showing that their hygiene's good or bad, showing that their compliance is good or bad, having that data there. It's really invaluable, you know, not only from perhaps from a financial aspect, if the patient's not being compliant and you need to charge for treatment extensions, now you have like hardcore proof, but also from a liability aspect, if something goes wrong, this way you can have that data there. And we don't like to think about that, but unfortunately that does happen, and you need to have a plan for that. So in any case, that's pretty much my review about DM. Hopefully that helps you today. I do recommend you use it on any kind of orthodontic patient out there. Price point is actually really low, and there's volume discounts, and I'm telling you, it will pay for itself in the long run, 100%. Not only, like I said, from the ROI in terms of your time, doctor time, chair time, staff time, but also from the liability and compliance standpoint, and not having any more of those headaches, because those patients will be significantly more compliant than regular patients. So in any case, do visit me at StraightSmileSolutions.com if you have any questions. All right, thanks so much.